$1.3 billion is what Nigeria needs to provide critical life-saving assistance to over 6 million people suffering from the devastating impact of the 13-year conflict in the Northeast region. This is coming from the United Nations Office for the Coordination of Humanitarian Affairs. Jessica Fida brings us details.
It's a protracted conflict, resulting in widespread of displacement and food insecurity. This is Bama, about 72 kilometers away from Maiduguri, capital of Borno State. Thousands of IDPs are taking refuge here. Women and children are the most vulnerable. At this stabilization center, 80% of patients are malnourished children.
Malnutrition is actually very severe in Burma because seeing the IPC classification, it is in grade 3 to 2, and at times it fluctuates because depending on the number of influx of individual we receive from the surrendered AOGs or following the operation by Nigerian force in the deep field. The number of cases before in a month, we can admit something around 50 to 70 cases. Even during peak, the maximum we admit is 90. But in last year, the influx of people had led to stretching of the stabilization center and also the health facilities in the community.
The United Nations Office for the Coordination of Humanitarian Affairs say it is working hard to bring succor to survivors of the 13-year conflict.
There are overwhelming needs. There are more than 8 million people who need some form of humanitarian assistance. And the crisis in Nigeria remains amongst the 10 largest crises in the world. What we want to make sure is that we can help people get back to a sense of normality where that's possible, so that we enable them then in terms of support for resilience, in terms of livelihoods, and eventually that people can return back to the places where they come from one day.
With effective emergency response by humanitarian agencies, victims of insurgency will have a cause to smile and start up life again. Jessica Fida, TVC News, Maiduguri.